I'm Dr. Paul Chung. I did my undergraduate schooling at Northwestern University. I went to medical school at Northwestern University Feinberg School of Medicine in Chicago, Illinois. Before I finished med school, I applied for and joined a program called the Health Professional Scholarship Program, which is a program through the United States military where the military covers the cost for medical school. And in turn, you join the military, and after medical school and residency training, then you serve in the military at a uh, military hospital. And so after I did pediatrics residency in San Antonio, Texas, then I served at two different US Army clinics and hospitals in South Korea. After that, I transitioned to becoming a hospitalist, so a pediatric hospitalist. So what that is my main duty was taking care of children who were more than mildly ill that needed to stay overnight at the hospital. So I did that for many years. While I was doing that in New York, I was heavily involved with also with teaching of medical school students and residents. And a few years ago, I transitioned to what I do now. So I'm a primary care pediatrician, part of Weill Cornell Medicine, which is a medical college faculty practice and our site is in Brooklyn, New York. And I work with two other pediatricians as part of our team there. When I grew up in Michigan and I grew up going to church with my parents on Sundays. And toward high school age, one of the activities that we participated in, that you could participate in, was going on trips to different countries or different parts of the US. And, when you went on these trips, it was doing certain humanitarian activities to help disadvantaged or underserved groups. Of course, another important part of those trips is for the students that went on it, like us, to mature and kind of doing certain activities and being part of those trips. And one of those trips, we went and it was going to a rural part of Michigan. And the doctors at our church were running a medical fair for migrant workers in the area who didn't really have access to healthcare otherwise. So as students, we went and just assisted with different tasks as part of the medical fair. So when I saw that and was part of it, you know, I th- that kind of planted the seed where I thought it was really cool that these doctors were able to use their skills to kind of help people who didn't have different privileges in certain ways. And I thought, as part of what I did, if I was able to participate in things like that, I thought that would I would be excited about that. So that was kind of the path. And I out of high school, I applied to a combined undergrad and medical school program where at Northwestern University, you have to meet certain academic standards, but you have a path through medical school as long as you meet those standards. And so for me, I was very fortunate where my dad, when I was applying to colleges out of high school, told me about that program where I otherwise wouldn't have known about it. And we had the financial means for me to start going to that program. So, as I was going through college and medical school, it was kind of a no-brainer. There were so many things that I was privileged and fortunate to have this opportunity. So it was too good of a opportunity to not finish, basically. The field of pediatrics is a specialty within medicine, and basically your expertise as a pediatrician is taking care of the different issues that arise for a certain age group from when a child is born until they turn around 18 years old, around there. So as a pediatrician, you're taking care of various issues. So when they're born, you're assisting the parents through all the issues that might come up with a newborn, like feeding and growth and what to monitor for. You're also dealing with urgent sick issues that come up where a child might have a fever or dehydration issues or vomiting or pain in certain areas. And these days, whether a certain symptom might be COVID or not, how do you evaluate for that? What signs to look for where um, the illness might be milder or more severe? And as the child gets older, you're also dealing with a whole wide different range of issues that are a little bit different than what I mentioned. For example, a adolescent or teenager or older child, they might be dealing with psychological or emotional issues, anxiety or stress for different reasons, depression. They might be dealing with bullying or different concerns about their sexual orientation or their sexual identity. So that's also part of our job, is trying to help as much as we can with families and children and teenagers through those types of things. And to become a pediatrician and be eligible to take the board certification, the residency is 3 years long. Usually, I'm working in that primary care office with the other pediatricians from around 9 to 5. There's other days we start a little bit earlier, hour earlier, and maybe an hour later, just to provide more access for our families who might have to work around school or work, things like that. And 2/3 of my week or day usually is having appointments and taking care of patients for the types of issues that I just mentioned to you. So each appointment ranges from around 15 minutes to 30 minutes long, depending on what type of appointment it is. And some of the appointments will be kind of new things that come up, like a new illness or pain or injury or concern. And then the other appointments will be well visits or health surveillance appointments, where as an infant grows up, we periodically have to check that they're meeting their developmental milestones and growing appropriately. And as the child get older, at least once a year, um, same thing, making sure that they're progressing in physical and psychological and their emotional health, whatever, to help with optimizing those things. And of those appointments, about 1/4 of them I'm doing as virtual visits, where through our electronic medical record platform, the parents or the teenager will make an appointment and they'll log on and we'll do an appointment like you and I are talking now. So, like if they were in the office, we talk through their concerns and what issues, and we'll be able to, it's it's better than talking on the phone because visually I'll be able to see certain things as far as how comfortable they look or how much pain they seem to be in, how alert they are. We'll be able to do certain visual parts of the exam, even look in the back of the throat, take a look at rashes, focus the camera on different parts of the body and see how comfortable or distressed their breathing might be. So that's something that at the start of the pandemic about a year ago, that all medical doctors are doing a lot more of these days. And it's not 100% perfect because there's certain things that you have to examine the patient in person, but in many ways, for families that might have certain difficulties getting in the office for various reasons, or their location, it just might not be easily accessible. It's exciting. It's an exciting development. And so I mentioned 2/3 of my day is doing these type of patient care activities, and about a third of my day is fulfilling managerial and oversight duties as the site medical director of our location. And so it'll just, at our location, it's not just us three pediatricians, but there's also adult medicine or internal medicine doctors. There's also obstetricians who take care of pregnant patients. And part of my job is just making sure through different operations and organizational things that the doctors and nurses and front desk staff and our medical assistants are supported in whatever they need to do. And I as we started, I kind of talked to you about my different roles as I progressed through my career. And that is one cool thing about medicine is that if you become a doctor or if you pick a specific specialty, you're not locked into just one type of job. There's so many different types of medical roles there are. And so I think that's pretty exciting. And when I was talking about the other staff in our location, day to day, uh, yeah, I should mention part of evaluating the patients is working closely with those staff and those nurses and medical assistants at our site because you can't take good care of patients without them. They're helping to screen them, get their vital signs, give do procedures afterwards, like give vaccines, do blood work, do different laboratory tests that we might direct and order. And besides me examining him and talking to the patient and the families, so we're also doing procedures in the office. For example, obtaining urine samples through catheterizations. That might be a procedure that pediatricians frequently do. Removing splinters, removing impacted earwax, shaving down a wart so that it goes away faster. So that's kind of a snapshot of my day to day. If I had to narrow it down to a couple things, so I get to hang out with different ages of children all day. So little babies, you see them grow up and they're not doing much except eating and sleeping as a newborn. And then you see them smiling and laughing more at 4 months old. You see them start to talk and babble as they get older and approach about a year old. And so things that every day I'm just in a position where I'm smiling and laughing and kind of enjoying that time. So that's a super cool thing about my job. Another thing I really like is, my personality, and most people are like that when you see someone struggling or a patient or parent being very stressed out about health concerns, whether it be physical or emotional. What if it has nothing to do with your job? Most people have this innate feeling where you want to help if someone is suffering. So I like how my job, when I see patients, as long as I just naturally do what I feel like I should or want to do, and the more you follow that desire, the better you are at your job. So that's something I really am thankful for, that my natural desires align with what I need to do in my position. you know ch- Children don't choose what time of day or what day of the week they're going to get ill, when and just people in general. So uh, it's a challenge where throughout my different positions and even now, I'm not just working Monday through Friday. There's weekends where all of us pediatricians, as part of our group practice, have to take turns being available on the weekends for urgent things that might come up. And same thing with things that come up at nighttime. And so all the pediatricians at our different Cornell sites, we take turns being on call at night along with other nurses that we work with, so that we're available for urgent questions, because parents will have questions about if their child in the middle of the night has a fever or a breathing issue or some type of rash or some type of injury, and they need guidance on, is this something we can monitor at home? Is this something that can wait till tomorrow? Is this something that's more serious that we have to go to the emergency room now? So there are days, and it's with my current position, it's not super frequent, but sometimes it had been frequent, where other positions I was doing it, every fourth night or so. So that is one challenge. Is as a pediatrician, you have to sometimes expect that you're going to be on call at night and be available to answer parents' questions about certain things that come up. Another challenge would be, the physical exam is an important part of evaluating what might be going on with a patient or a child. And depending on the age of the child, of course, they're not going to know that they have to cooperate with opening their mouth or staying still while you get a good look in their ears, being quiet when you listen to their heart. So the longer you become a pediatrician, you have to come up with tactics and how do you distract them, or how do you assuage their fears, or how do you make the child less stressed, or even a 6 or 12 months old, how do you somehow approach them in a way where you're able to get a good exam. And so that's a challenge, but that's also a exciting, cool part of the job where you learn things and you realize, oh, I'm finding out better ways to do this the longer I do this. There's a, a lot of continuing education activities that you can do. So a big part of it is, staying up to date with reading research that comes out in medical journals, new guidelines based on new research that people have done. So there's a lot of reading involved. There's continuing education conferences where you attend and you network with other pediatricians. You listen to lectures from subspecialists within pediatrics about the newest guidance and research. And one interesting thing about that is, with so many things with the pandemic going online, it's in a way easier to attend those types of conferences. They've all been virtual over the past year or so. And more than before, now there's webinars where periodically, once a week, professional societies like the American Academy of Pediatrics, it's pretty easy to join and listen to experts in different topic areas and learn from that. And with every specialty like pediatrics, the certification board has maintenance of certification requirements and activities where you're doing certain practice questions and different topics online. You're doing certain projects where, as you do those projects to try to improve your practice for your patients, you're learning at the same time. So many different ways that you can stay up to date in your field. So, like I talked about when I was mentioning the virtual visits that I and other pediatricians do. So the field of telemedicine has grown exponentially over the past year, and I believe it'll continue to do so. And so some of the things you read about and see certain practitioners doing is trying to make this type of virtual visit with the patient as robust as possible so that you can get the best information. Again, you're not going to want to do every visit virtually over the video, but there are many situations as far as what that family might have access to, whether it's a certain subspecialist in the area where it can be very beneficial. So I think there's a lot of work being done on making the technology better and more accessible, where instead of just getting a visual exam that we can see pretty simply over the video, but using certain devices at the site of the patient. For example, you in the as things develop might have a certain tool that you kind of put on your ear, where I could remotely look inside your ear, or a tool, some type of device where I would be able to look at your heart tracing or listen to your heart and lungs. So it's kind of exciting to see what developments might be to make these types of telemedicine visits even more robust. And another another benefit that might come from these types of virtual visits is with certain adolescent issues or stuff that teenagers are dealing with, because there's going to be certain things when you get to a certain age where maybe you do, for a certain family, feel super comfortable being very open with your parent or parents about everything. But realistically, there are certain situations where a um, 15 or 16-year-old is too embarrassed or doesn't feel safe or would prefer to keep something confidential, something that's causing them depression symptoms or some issue with bullying, or again, certain issues with their sexuality, a whole host of things that they might want to talk to the pediatrician or doctor confidentially. So if we can use telemedicine to make those types of visits a little bit more comfortable and available and more accessible, it might contribute, because a lot of professionals are already doing this, I should say, psychiatrists, for example, and making these types of things available. So that's another exciting thing if we can, enhance the care of these adolescent teenager issues through the use of telemedicine. I would say, find, just like any profession, find out, what you can about what it really entails to be a doctor. So if you have access to it, spend time shadowing a doctor and see what the day to day might really be like. Because there is a lot of dedication and time into finishing the steps that we talked about, going to college, then medical school, then residency training. And one important thing to note is that it's not just a commitment to finish that schooling and training, but it's an ongoing commitment to stay up to date and continue learning about the best way to take care of patients and support them. So, you know, that's why I think it's, when I heard about the project that you're doing, I was happy to be part of it and help in any way I could, because this is one way that you're making it easier with kind of COVID concerns for students to do that. So learn more about it as you decide whether you're going to commit to this path.